Hi, Dr. Huebert. How are you today?
Good, Bill.
Well, let's talk a little bit. In previous videos we've discussed a lot of things, but I really want to talk about the gamut of regenerative procedures you've been involved with over the last decade. And if you could talk a little bit about the most common procedures you use here at the clinic in Portland, Oregon.
Okay, so it's a little bit of a hard question to answer because I use all the procedures. Some obviously more than others, and if I kind of give you a little brief history, um, the original regenerative medicine is prolotherapy. Prolo is using dextrose, and we're basically using it as a stimulant to help your body with healing. Um, that was originally discovered about 1921, and had some bad outcomes. People were putting things besides dextrose in injections and caused some deaths, and obviously it's bad form, so it really got a black eye, and it still actually does today. People call it voodoo still, but it has a place and it works very nicely for certain things such as instability, SI joints, ankles. It's something that can be used in season during activities, and it's minimally painful, works very nicely. The kind of the corporate world, the first and original regenerative treatment was actually hyaluronic acid. The reason it worked wasn't a lubricant for the knee, it was because it actually stimulated a little bit of repair in the joint. So unfortunately, most insurances now don't cover it because it does work, and apparently they weren't making enough money on it. So what kind of the stepwise and what I have in the clinic. So first is Prolo, fairly inexpensive. Next is PRP, using your body's own blood, which has also been around for quite some time. And it can be basically used anywhere that you would use a cortisone injection or anywhere that you want to try and actually help with healing. So cortisone is a catabolic agent. It will actually break down connective tissue if you get too much. The regenerative field is more of an anabolic, which means we're trying to repair and regrow connective, healthy new tissue, or new connective tissue. So the goal isn't just to make you feel better, it's to actually try and heal you. So PRP is a very simple blood draw done in the office. Takes about 15 minutes to draw the blood and separate it, centrifuge. And then I always use guidance with all my procedures. So if I want it to get into a partial cuff tear, then I'm going to guide it directly into that partial cuff. If I want to go into a knee joint or an ankle or a toe or thumb or something, it's always guided, and we use the appropriate amount of whatever treatment option that we're doing. So obviously I wouldn't use a giant kit to treat a thumb joint, so we use little small amounts and the appropriate amounts for what's needed. Beyond that, then, the regenerative field has kind of really blossomed probably in the last 8-10 years. So there's things now that we use to aid with regenerative medicine. So one is A2M. A2M is a molecule that's naturally found in your serum. So again, we draw the blood, it's very similar to PRP, but we run the serum through a filter and we extract this protein that binds all of the inflammatory garbage that's in an arthritic joint. So what does that mean? That means that we will inject it into a joint, it'll bind all of the arthritic things that are in the joint, allows your body to remove that garbage. So now you have basically a clean joint that has a healthy environment, and that in itself may be beneficial by itself as a standalone. Sometimes we'll then follow it up with PRP or stem cells or some other more aggressive agent to try and repair or make a repair in the connective tissue. There's other things that go along that list as well. Some are the amniotic products. These are processed products from live births. They're healthy donated tissues, they're screened, they're processed, and I used to use some of these things. I don't really use them anymore. I don't like processed donated tissue. It depends on the purity and how they're made, so there's different manufacturers and you never really get the exact same thing. So I've tried all those things, including cord blood, amniotic fluid, Wharton's jelly. These are all post-birth products. I don't use any of them. Not that you can't, I just rather use your own living tissue or try to keep all of the variables to a minimum. So that brings us to actual stem cells. So
I
there's
see
really,
we have a bone kit here on your table.
yep. So stem cells there's only two that are acceptable unless you're part of some, research project. They have to come from you and they're for you. So under certain exceptions of bone marrow transplantation, when somebody has cancer, the stem cells we use has to be obtained from you and they're for you, which means they have to either be from your bone marrow or from your fat. And they're extracted simply in the office, done the same day. This is a bone marrow kit or a bone marrow trocar. It's very small. It's not a giant hammer. I don't hammer anything in. I numb the periosteum, typically around the hip, the connection around, or the tissue around the bone, and we very carefully extract the bone marrow. We then concentrate it, and then we use those stem cells as the same way that we'd use PRP. We inject it into a joint, into a tendon, into a ligament, have used it in the disc and around the spine as well. The other source is fat. Fat is, again, used as a trocar. It's a little bit bigger than this, but we numb the skin and then we do a mini liposuction. Again, I do this by hand. This isn't a giant Brazilian butt lift kind of, extraction with a big vacuum. We don't need a lot of cells, but you do need some, and there's benefits to both of those, why you use one over the other. Bone marrow typically has not only a way to repair connective tissue, but it also has a vasculogenic cell line to it, which means it will help promote vascular supply. So in the human body, without blood supply, nothing heals very well. So you want to induce a blood supply. The fat has a higher concentration of stem cells, which are used to help repair connective tissue, but I typically have to enrich those. So I either have to add a PRP or something to help stimulate a vascular supply with the fat. Both are excellent options for depending on what the treatment or what the injury or issue is. The latest thing that's come down in the last few years is something called exosomes. Exosomes are microparticles. What does that mean? Well, it means that stem cells will release little particles of information that act just like the stem cells. The benefit is they're very small. They can be given IV. They can be given into the spinal column. They can be given anywhere that you would do bone stem cells or PRP. The advantage is it's something I don't have to harvest. So it comes from a Chimera Labs, which was initially the only approved FDA lab in the country. I think there's one other since then. It is a bioengineered product, which means there's no donors to it. So the product is replicated and it's bioengineered, which means that we get the exact same product every time we use it. What's the advantage? Well, I don't have to harvest bone marrow. I don't have to harvest fat. It has all the benefits of stem cells without the risks of giving you DNA or somebody else's DNA. What does that mean in real time? Well, that means that I can now treat a concussion. I can give you something IV. I can have you snort it like a nasal spray to treat headaches, to treat post-concussive syndromes for the people that were in a car wreck and have whiplash and have this migraine headache that won't go away. So there's lots of applications for it.